Who can I call?
What department can I go to?
Where do I go?
We need help.
What can I do?
Welcome to In Touch with Pinellas County. I'm your host, Jane Merlin. How much value do you place on your health? Oftentimes, we don't think about it until we're faced with an illness. And for many in our community, the cost of medical care may seem out of reach. Today, we're in touch to learn how Pinellas County is working to improve the health and wellness of its residents. Dr. Yuli Cho was appointed Director of the Florida Department of Health in Pinellas County in 2015 and is here to tell us about the Pinellas County Health Program. Welcome, Dr. Cho.
Thank you for having me.
Let's have you start by telling us a little bit about the Florida Department of Health.
Well, the Florida Department of Health is an integrated state agency. There is a health department in each of Florida's 67 counties. I really stand behind the Florida Department of Health's mission, which is to protect the community, to promote good health and good choices, and to improve the health of our community through integrated efforts. And in order to achieve this, we provide a number of services for environmental, from STDs, immunizations, family planning, as well as primary care and mental health services.
What are some of those environmental issues that you deal with?
Well, we want to make sure that the beach doesn't have high levels of bacteria. We work with the regulations for tattoo parlors, sunbathing, piercings, among other things.
And I understand that you also administer Pinellas County's health department. Tell us a little bit about that program.
Absolutely. We provide the medical services as well as dental services at 5 of our clinic sites. Again, in partnership with the county, we contract with behavioral health organizations to add that referral network. In addition, with the county again, working with the homeless population and addressing their medical, dental, and mental health needs through our mobile medical unit as well as our safe harbor operations.
And who is eligible to receive these services?
Well, the county does have eligibility specialists at our sites, and some of the criteria they use is less than 100% of federal poverty line, that they need to be a county resident and have no other forms of insurance. So the idea is to serve those that really can't get insurance otherwise.
So this is kind of the last resort for many of those individuals who literally don't have access to insurance and other means of health care.
Absolutely. And the concern is if people don't have the insurance and they don't have the primary medical homes, and what they end up happening is they go to the emergency rooms, which really isn't a best way to deliver preventative services, and there's a huge cost to the healthcare system with that.
And I'm sure that the cost in going to an emergency room is very, very high.
Absolutely.
Now, I know that there are county eligibility specialists in some of the Department of Health locations, as well as navigators, and so it brings to mind the question of you have a lot of partners that you work with in the community. Tell us a little bit about some of the other partners that you work with.
Again, going back to the Pinellas County Board of County Commission, I think we have a great partnership, so again, ensuring that access to care. And with that, we work with behavioral health organizations such as Directions and Suncoast to provide that mental health counseling as well as psychiatrists. We have a great partnership with the Juvenile Welfare Board that helps and supports us in our sealant efforts at the schools, our school-based clinics, as well as our maternal child health home visiting services.
Now, you mentioned sealants. I'm curious about that. Tell us what that is.
Sure. The sealants is a coating placed on permanent teeth of the young. So the idea is to prevent the cavities forming in the first place. And what we do in partnership with the JWB is to get a mobile team out there to our various elementary schools in the county and provide it during the school day.
Now, I understand that your program really looks at the whole patient. Tell us about this integrated approach to healthcare that you use.
I think that goes to speak about the importance of the mind-body connection. And really, mental health and physical health go really hand in hand. As a physician, I can tell someone to take their blood pressure pills, but if they're too depressed to take it, or their mental issues are acting up, then it really doesn't do any good. You really have to tackle and address both the medical as well as mental health issues at the same time. And the way we do tackle that is we have this co-location. We do have the providers that addresses the physical needs, but at the same time we do have the mental counselors co-located in those sites.
So you really have all of the medical capabilities within each medical home?
We do, and there may be some vacancies, but we are working to fill those as well.
And so how many individuals are in your staff at these locations? I'm sure it varies depending upon the location, but...
It does, and again, we have 6 main sites, buildings for the health department. The Department of Health employs over 700 staff to do not just the clinical services, but a number of our services within public health.
Dr. Cho, what can we do as patients to have a better outcome as it relates to our health?
Well, I would ask the patients to be your own advocate. Don't be afraid to ask your physicians the questions. If you don't understand something, make sure that they clarify before you leave the office. And then on top of it, follow the physician's instructions when possible. Eat better, exercise more, abstain from tobacco or other illicit substances. You really only have one body in this life.
And I guess we really have to be a little bit more open and forthcoming in some of the issues that we're coming to our physicians to get help with.
Right, absolutely. I think what it comes down to is a great relationship, a great communication between the doctor and the patient.
And I think oftentimes maybe people feel intimidated when they talk to a physician, but really you are all there to help people get better.
Absolutely, and again, just the way how medicine is currently, that the doctors may need to see a certain amount of patients, so they may have to look at only focus on 1 or 2 issues per the patient. And I think it's really beneficial on the patient's part to really bring up those questions, the concerns that they have, maybe list them prior to the visit, and again, don't be afraid to reach out to them. That is what a physician is there for.
And we really shouldn't be embarrassed by having to bring up some of the issues that are of concern, right?
Absolutely.
Now, I saw a couple of statistics recently that really caused me to kind of sit up and take notice. And there was a report that I believe it was about 63% of adults in Florida are at an unhealthy weight, and 1 out of 3 kids are considered overweight or obese, and I find that to be very alarming and concerning. That was, I believe, a state study. How do we compare in Pinellas County?
Fortunately, where our numbers are a little bit better. For adults, our unhealthy weight is about 61.1%. By unhealthy weight, it means both obese or overweight. And for our kids, it's 26.3%. So a little bit better, but this really highlights the importance of a healthy weight. Obesity, overweight's linked to chronic diseases such as diabetes and heart disease. And keeping in mind that heart disease is the #1 killer in the U.S., Florida, as well as Pinellas County.
So if individuals and children start to get their weight under control, can they see some pretty quick results in terms of health improvement? Or does it depend on the issue that they're presenting with?
It certainly does depend on the issue, and then there are other things, other comorbid conditions. If they have diabetes and stuff like that, they need to take care of that. I think it's just one of the key things that you need to address. And going back to prevention, by preventing it from occurring in the first place, developing obesity and overweight, you can prevent yourself later in life from developing those other conditions.
So somebody who may have a weight issue, what is your recommendation to try to help them get that weight under control?
So some of the recommendations, and this is by the CDC, is make sure that you have 5 servings of fruits and vegetables a day. Spend less than 2 hours FaceTime on the computers or iPads, etc. Exercise 1 hour a day, and really avoid any sugary beverages.
So step away from the electronics would be a real important step.
I know it's sort of difficult in this day and age, but it's certainly something we recommend. You need to be more active when you can.
I think we all need to get up and move a little bit more.
Absolutely.
Yeah. Now, nutrition, as we all know, does play a really important role, but sometimes in some of the communities we see that there's a real lack of easy access or affordable access to the fresh fruits and vegetables that are being recommended. So how do we deal with those areas that are in what is considered a food desert?
You bring up a good point. Again, as a physician or a public health official, I can tell someone to eat better or exercise more, but if they don't have access to those healthy foods, such as those in those food desert areas, or they don't have access to the gyms, the trails, the parks to exercise, then really it doesn't do any good. So it's important as a community to look at those environmental factors. And fortunately for us, we are fortunate to have the federal PITCH grant, which stands for Partnerships in Community Health. We do have a partnership that are looking at those things. We have programs such as Fun Bites, which highlights what are the healthy foods on a particular menu. We have fitness zones where we have exercise equipments within the parks, but there's a number of initiatives that they're doing to sort of address those environmental concerns.
I've seen those exercise equipments in some of the parks, and I think it's a wonderful addition.
Absolutely, and studies have shown that the areas that do have those exercise zones are people are more likely to exercise, and again, obviously, it will have an impact on the health, the unhealthy weight of a community.
And you do feel better when you're moving around and exercising.
Mm-hmm.
What, in your estimation, are some of the most serious health issues in Pinellas County?
So, for that, in terms of the top priorities, what I refer back is to our community health assessment as well as our community health improvement plan. And what they do is gather the community stakeholders. They survey the residents to figure out what their priorities are. And that's when I'm asked that question, what are the priorities, I sort of look at those documents. We do that every 3 years. What we found in this last cycle is, again, access to care, and that means both on the mental level, medical as well as dental, chronic diseases such as obesity and overweight, as well as other behavioral health issues.
I want to mention, in the time that we have left, I know that there's a lot of excitement building around the opening of the Bayside Health Clinic. Mm-hmm. It's opening April 2016. How is that going to benefit Pinellas County?
So currently what the Bayside Clinic is going to do is move our safe harbor operation to a standalone building. Currently with a safe harbor clinic, you can only serve those people residing in the safe harbor building, but with it being on the outside, you can sort of serve the community. Again, the focus there is similar to what we're doing in safe harbor, with the focus on providing medical, dental, and mental health services to the homeless population.
Sounds very exciting, and wanted to find out, what are some of the other initiatives that you're working on that are happening in Pinellas County?
Sure. So some of the other initiatives includes, there's a statewide initiative called Healthy Babies. What that is looking at ways that we can prevent infant mortality, looking at our numbers, and then addressing and being aware of the racial disparities. Unfortunately, the African American population do have higher, disproportionate number of infant mortality rates than the overall rates. We're also working with the hospitals, trying to get healthy, friendly baby designations to promote more breastfeeding.
So lots of initiatives that we can look forward to. As a physician, if you had one piece of advice that you could give us to improve our overall health, what would that be?
I think it goes back to the doctor, going back and making sure you have regular checkups. I know a lot of times our life gets busy with the work, with our kids, but you really need to take care of yourself, and health does come first.
Is there anything else that we should know about the Florida Department of Health in Pinellas County?
It's all about teamwork. It's a community response. We all really, living in a community, we all have a stake in public health, and we all have a role to play. So if anything, I think we should get involved and really work as a community to address those major health issues.
Very good. Thank you for joining us today, Dr. Cho, to talk about how to become healthier in Pinellas County. You can learn more about the Florida Department of Health in Pinellas County at pinellashealth.com or call 727-824-6900. Additional information about the Pinellas County Health Program is available at pinellascounty.org/human services, or you can call Pinellas County Info Line at 727-464-3000. That's all for this edition. I'm Jane Merlin, hoping you stay in touch with us. Thanks for tuning in today. See you next time.